Really important video today with regards to pregnancy, preterm labor. What are some contraindications to a pregnancy? Now, there are going to be 7 contraindications to a pregnancy that we need to learn for the USMLE. Alright, so the first one is going to be any severe and symptomatic aortic stenosis. Okay, so severe and symptomatic aortic stenosis. Then we go also severe symptomatic mitral stenosis. Okay, then we can also have coarctation of the aorta. So if there's going to be some severe symptomatic coarctation of the aorta, we can also have ejection fraction less than 35%. Recall that ejection fraction should be above 60%, and in normal human being. And then we can also have the pulmonary arterial hypertension can also be there as well. We can also speak about severe aortic dilation. That can be an important one. We can speak about peripartum cardiomyopathy and peripheral artery disease. So not pulmonary artery disease, which we've already spoken about. Okay, so we can see that the basically peripheral pulmonary artery disease, elevated blood pressures, that leads to the right heart strain failure. And the pregnancy, there's going to be more blood volume or cardiac output, so that'll make it even worse. Aortic dissection, basically in pregnancy, there's going to be increased blood volume, cardiac output, and this will put pressure on the aorta and cause it to rupture. Then we can have over here severe mitral stenosis. So severe mitral stenosis can be a pregnancy contraindication during pregnancy, because over here the blood volume increases to about 40 to 50%, which can cause severe amount of pulmonary congestion and can lead to heart failure, arrhythmias, and you know what else. Then we can have over here, guys, preterm labor. So guys, preterm labor, what is going to be the risk factors? So preterm labor is going to be any sort of prior spontaneous preterm delivery. We can have multiple gestations, short cervical length, that's a really important one. And we can have over here the cervical surgery with cold knife, coinization, and all that good stuff. How are we going to be doing screening and prevention over here? We can see cervical length measured by transvaginal ultrasound and the progesterone administration and circulage placement. Let's come over here and let's look at some questions over here. So I have some questions over here. So a 16-year-old woman, or a girl I would say, is pregnant. What is she an increased risk of? That is going to be preterm delivery. Neural tube defect was the wrong answer here. Okay, this is an important one. I believe I've even gotten this question twice wrong. So a 32-year-old female who has gravida 1 para 0 at 19 weeks of gestation has cervical insufficiency and bulging amniotic membranes. Can we give circulage? Answer is no, because there is going to be bulging of the membranes into the vagina. This causes prolonged exposure to vaginal flora and a high risk of intra-amniotic infections. So we can see over here chorioamnitis is preterm membrane rupture, abruptio placentae, and a preterm delivery, and maternal morbidity. We can see prolapse membranes increase the likelihood of complication due to the high risk of iatrogenic membrane rupture. Therefore, even with successful circulage placement, the prognosis for this pregnancy is poor, and most likely outcome is of the preterm delivery. Okay, we can see over here a 32-year-old female. She comes to the 19 weeks to the ED with vaginal pressure and spotting. We can see clear vaginal discharge, increased pelvic pressure. Speculum shows amniotic membranes bulging into the vaginal introitus. Cervix is 3 centimeters dilated, and there's going to be 100% effacement on digital examination. So what's the diagnosis here, guys? It's going to be very simple. It's going to be cervical insufficiency. As we know, there's going to be structural weaknesses, which causes painless cervical dilation in second trimester pregnancy loss. The pelvic pressure with gestation depends on the vagina, increased vaginal discharge due to loss of the mucus plugs and the vaginal bleeding. So we can see a negative fetal fibronectin test prior to indication of low risk of preterm delivery. So we can see a high negative predictive value of fetal fibronectin levels are until 20 weeks are not a reliable marker for preterm delivery in early pregnancy. So guys, let's just quickly come over here and recap this over here. What are going to be the 7 contraindications of pregnancy? We're going to do this together, okay? Severe symptomatic aortic stenosis, severe symptomatic mitral stenosis, severe aortic dilation such as Marfan syndrome because pregnancy can have pressure on the aorta, severe coarctation of the aorta, pulmonary artery hypertension, heart failure with ejection fraction less than 35%, and then we can have pulmonary artery hypertension. Preterm labor, what are going to be risk factors over here? Risk factors are going to be prior spontaneous preterm deliveries, multiple gestations, a short cervical length. We can see over here cigarette use, and maybe some previous cervical surgery. And if you're going to have high fibronectin, it can be a indicator for preterm delivery, but this may have negative predictive value. Guys, I hope you guys found this video useful. It was all about preterm pregnancy contraindications. Hope you guys found this video. Thank you guys so much for watching. I hope to see you guys next time.